Hi, I'm Jackie Skramstad. I'm the Regional Director for Mindsprings Health. Today, my focus is going to be, as was announced earlier, we're not talking about the entire continuum of services that we offer, but the real focus is on integrated care, our case management, and peer specialist programs. I wanted to start, though, by reminding everybody that adults without children now qualify for Medicaid. I do continue to hear concerns about access to health care, and I really want to make sure people understand that, because I know for years it was drilled into our heads that single adults were not eligible for Medicaid. People are, and I know, Mary, our rolls are growing in Garfield County. I'm assuming they're growing in Pitkin County as well. But please, just know that. So the folks that are homeless, that are out of work, that are really struggling financially, please make sure we're connecting them with the county, get them set up with Medicaid, not just for mental health services, but for all of their health care needs. I think that's really important. So, integrated care. What is integrated care? For a long time, we've had partnerships, like with Mountain Valley Developmental, where we have a psychiatrist go out and provide services on site for some of our joint clients. We run a group that's co-located at Catholic Charities. They work with us with some space, but that's not really integrated care. That's more co-location. It does bring the services to the people, but integrated care is a whole nother level of integration. We have developed integrated care programs with Mountain Family Health. I'm going to start saying Mountain Valley Developmental now. I'm going to get those confused. Mountain Family Health. We do have integrated care folks on all of those sites, and I'm going to tell you what they're doing. But first, why is that important? If you've been in the field as long as I have, you've known that there is a connection between physical and emotional health, right? We all know that. I think the field is finally starting to recognize that in a more formal kind of a way. And also really recognizing that there's just a lot of complaints that people are going to go to their primary care physician to seek help with. If you have stomach aches, intestinal issues, you're going to go see your doctor. It may not even register that your anxiety or worry may be contributing in some way to that physical issue. If you're having trouble with sleep or energy, people may not clue in, oh, maybe it's depression related. You're going to go see your doctor. I can't sleep. That's where people go. So again, the movement is, how do we get the services to where the people go? The other thing I think that's really important when we talk about integrating all types of health is folks with a mental illness tend to die 25 years earlier than the average other individual. And so when we talk about integrating people's needs, that's really because of challenges with taking care of themselves, accessing health care, following plans when you have some chronic mental illness that may be more difficult. So this integration is really, how do we treat the whole person? How do we bring mental health to where the people go, which is primary care? So one type of individual that we have is called an integrated care clinician. We have 1.5 of these. Well, actually, she's a whole person, but she's there half-time. At Mountain Family Health in Glenwood, we have a half-time position in Eagle and a half-time position in the Basalt Pitkin County Clinic. And what these folks do is not standard therapy. So it's not like you have a little office in the doctor's office and people come and they see you for the 50-minute session and then they leave and therapy as usual. It's very different. So how this works is somebody may come to the doctor and say, I'm having a lot of stomach issues, intestinal issues, and the doctor may do what they do to figure out what that's all about. And they may realize, you know what, this person's really got a high level of anxiety. That's not what I'm going to be able to treat as a primary care physician. So they introduce them to their colleague, Jackie Skramstad, or whoever that is. They introduce them to their colleague, and that integrated care clinician can sit down with that individual and in a more brief intervention help connect with them around some of the other issues that may be connected with the physical complaint that brought them into the doctor's office. It is much more brief intervention. There can be follow-up interventions to that, but the idea is that it is brief, it is more educational, it is providing some behavioral, maybe relaxation in this case, but some different short-term interventions to help folks with issues that may be contributing to their medical complaints. The other thing the integrated care clinician can do through education and even some motivational interviewing is if there is a need for more extensive traditional mental health or substance abuse treatment, they can help bridge that gap and help get the person ready to show up at Mindsprings or some therapist's office. Because you all know with change, you can't just day one say, you know what, I think some of your stomach issues are related to worry. Here's the card to Mindsprings, call them, go set an appointment, they'll help you. That doesn't work, does it? So having somebody in the clinic at Mountain Family that can really help bridge that gap and get people ready to make that step is what integrated care is all about. Let's see. So the other type of integrated care worker that we are also working with Mountain Family Health and Rocky, I should say, Rocky Mountain Health Plans have been partners in these as well. They'd probably want me to mention that. So the community health worker. Community health worker is not a therapist. They are really trained to help with behavior change. And this can be behavior change for any kind of medical issue. Now, I'm guessing I'm not the only person in the room that has ever committed to a behavior change and struggled with that. And what I mean by that is I'm guessing, and you do not have to show your hands, but I'm guessing there's people who have decided tomorrow is the day I'm going to start my new workout plan. Tomorrow is the day I'm going to start this new diet, or I'm going to cut out sugar, or I'm going to give up smoking, right? We can all think of things that we have done, and when we say them, by golly, we mean it, don't we? I am totally going to be walking every day starting tomorrow. It's on my book, I'm doing it, I totally mean that, and then the next day comes and what happens? You start to make excuses, maybe, maybe not, I'll start tomorrow. Behavior change is hard. So what the community health workers are doing is they are getting referrals really from Rocky. Rocky is pulling names of folks that are Rocky Mountain Health Plan customers that are high utilizers of the ER. And the thinking is the reason that these folks are high utilizers of the ER, and they do not have to have a mental health issue, by the way, but is that whatever their medical issue is, or combination of different issues, they are struggling with the behavior change needed to manage their illness in the best possible way. And so they keep coming through the ER. They keep coming to the doctor's office. So what these folks are out there doing is helping walk people, coach people through the behavior change, helping them set up systems, maybe reminding them, making phone calls, driving them to appointments if that would be of help. But really helping bridge that gap from our desire for behavior change and knowing it's important and needed to making it happen. And I think we also know that once you make a behavior change, you can really get into a rhythm with it, right? And then it starts to feel a little more natural. And so these folks are, how do we get, the community health workers are helping people get into a rhythm of taking care of their medical issues. Whether it's dietary, medication, keeping appointments, life skill changes, it's really walking people through that. So these sound awesome, right? Like, why isn't this at every single primary care office all over the Roaring Fork Valley? Wouldn't that be awesome? Healthcare is changing at I swear it's a daily rate. I don't even think I can keep up with the changes in healthcare. But one of the things that's happened is this idea, concept is happening, it's implemented. We've had this going on at Mountain Valley for 3 years with integrated care, and it's just gradually expanded. The difficulty is that insurance in the state of Colorado has not kept up with allowing this to be reimbursable. So even though there are codes that we could use, those codes are not open in the state of Colorado. So that's what Sharon Raggio, our CEO, and others in the behavioral health world are really working for some state changes on how do we keep up the policy changes to make this, continue to make this a part of our healthcare continuum. And so that's why you'll see our partnership is with Rocky Mountain Health Plans. They're actually funding this because they believe in the results for the folks that they serve that these types of positions offer. But clearly more change on a policy level is needed for that. The folks who access integrated care, the doorway to that is really through Mountain Family, or if we expand through that primary care. These folks are not coming to our main office to get set up. They're just in their doctor's office and get handed over to somebody and connected in that way. And all of our documentation, when we talk about integrated care, all of that documentation, it lives in the medical chart. They don't have charts with Mindsprings Health. It truly is, we are in that system, part of that system, a team member in that system. Okay, so that's integrated care. Case managers, peer specialists. Case managers have been around forever. Case managers, though, are really seeing an increase right now in the behavioral health world. And part of that, well, a lot of that is related to how fast this area is growing. Healthcare is a growth field. If you've got kids out there, you want to get them into a growth field, healthcare is growing. And I don't know what the current stats are now. I remember when Sharon Raggio addressed our team a year ago when we were doing the crisis stuff expansion. There were like 500 and some open positions in behavioral health agencies like Mindsprings statewide. There are not enough therapists to step in and fill all of those positions. So part of the movement with case managers is to keep some of that coordination of care functioning, getting people connected to resources, a lot of that traditional helping people apply for stuff. But the other thing you're going to be seeing with case managers is an increased level of supportive services and delivering services at their appropriate educational level under the direction of a therapist. And so you're going to be seeing case managers more and more as therapist extenders. So let me tell you a little bit about what that may look like. Let's say we have a client, and for those of you who know me, DBT has been part of my heart and soul for many, many years. So let's say we have a high needs client who struggles with thoughts of suicide on a regular basis, has a lot of challenges. Maybe the therapist sees this person once a week for individual. Maybe they're in our DBT group. And then we decide, you know what, I'd really like to have another contact with this person. But we can't make maybe 2 individual therapy sessions in a week work. So what can we do? The therapist can work with a case manager to say, you know what, I would like for you once a week to do these mindfulness practices with this person. Mindfulness is a lot like being in the present moment, some relaxation. I want you to do this. Or we may have a case manager trained in DBT to be able to do some skill work in between therapy and groups. So that again, we've given somebody a meaningful contact, they're learning the skills, but we're extending the therapist so they're not meeting with the person 2 and 3 times a week, but they're meeting with them weekly, and we have a group with the therapist led. So that may be one way you're seeing things happen. I know we were just talking about another opportunity where somebody is struggling with depression. The therapist has her plan. This person has some risk, and we wanted the case manager to see them in between. And again, giving the case manager a very clear assignment, which was to help this person who doesn't have a real structured day, so they sit around and think about things that upset them, right? So this case manager's plan for their session or 2 that they're going to see this person is to not only check in and see how they're doing, but also to work with this person on a structure for the day. What are some things that they could add to their day? What are some of their interests? how can we help you set up a plan to follow so you're not just sitting in your easy chair being upset all day and depressed. So those are some of the ways that we are expanding our use of case managers, and you will see more case managers. In the Glenwood office, we have 3. We're working on another partnership with Human Services to add a 4th. The Rifle office has 1, and they are looking to hire another. Eagle, Pitkin, both have case managers, and they're looking to continue to expand that. So this is a growing area. It's also an area we are working at. You know, this is a little bit new, so we're working this out as we go. How we use them, how we maximize our use of therapists and use people with other skill sets to help folks as well. Our case managers also, and this is something that they've done for a long time, is provide a lot of supportive services. So many of our folks with a chronic mental illness out in the community, it's hard to travel to our office. So our case managers go out, they do home visits, they check in with folks, see how they're doing with their wellness and recovery plan and managing their mental health issues. And that is something we continue to do with our case managers. And we do have vehicles in a couple of our locations. Pitkin does not right now, but we can help transport people also to appointments, and again, help reduce barriers and make sure people get the care that they need. Okay, the last position is peer specialist. Mindsprings Health has had a very robust peer specialist program in Mesa County for years. It has taken a while to get some traction in the rural areas. However, I think we just about have peer specialists in all 9 of our rural counties now, at least 1. Pitkin has 1, Eagle has 1, Garfield County has a child and family one, and we are rehiring our adult peer position. So they exist. What is a peer specialist? A peer specialist is someone who has lived experience. So this is somebody who maybe has had a mental health issue, a substance use issue, some kind of behavioral health issue themselves. They are now in recovery, stable in their own wellness, and now they are giving back by being in a position of helping others. This is a paid position, although I know one of the questions from Jill was are there volunteer opportunities? And I'd like to think that this may be an area as we grow our peer program where there may be some opportunities for some volunteer options. Our peers do go through evidence-based training. We don't just say, hey, great, you have lived experience, go forth and do good things. They do go through an evidence-based program. I know one of those is called the Georgia Model. There's a couple others that we utilize. And these folks are trained to run groups, provide individual support, do outreach, be engagement specialists. I think it's very different message when somebody who is struggling with depression and suicide is approached by somebody else who's had a similar life experience to say, hey, I've been there, there is hope, than a professional person. I mean, I think that both have their role, but I think there is some real power and benefit to what peers offer. This does not just exist in Mindsprings. This is a nationwide movement around adding peer specialists to the behavioral health world. And we are also using peers to provide some respite. And so what that would look like in the rural area is, let's say our crisis line was called and the crisis worker goes out, assesses this individual. They don't meet hospital criteria, right? But maybe they're distraught and they just need somebody to sit and be with them for a little while. We can call in a peer and say, you know what, Jackie Skramstad's really just distraught. She doesn't meet hospital criteria. It's not that level. She really needs to connect with somebody though. And our peer can come out and sit with them and be there for them for a couple hours. Because really when people are in crisis, making another connection with somebody else is so important. And so that is a really important service, and that's what we're trying to provide with some of these peers as well, is expand that capability. So let me see if I covered all my notes on peers. Yes. So I'm sure there'll be questions at the end, but I want to make sure Jess gets her chance. So, so that's just some of the programs. And again, I hope you see the movement is really how do we in the behavioral health world continue to move services to where the people are. I mean, there still will always be a place, I'm sure, for people to come to our office, but to make that more seamless and to have less walls and be out and in the community, a part of the community, a part of entities in the community. And we're willing to partner to continue that movement because it's very important. Thank you.